gram-positive bloodstream infections. So what are the common gram-positive pathogens? We have Staph aureus, which is going to be commonly associated with any indwelling catheters like IV drug users, central venous catheters, skin infections, prosthetics. Cons can be seen in the setting of central venous catheters or prosthetic material, often a contaminant. You have to be careful about it. Enterococcus can occur because of infections of GI-GU tract. Pneumococcus can be seen in elderly individuals, alcoholics, HIV patients, and if the source is sinopulmonary, you can think of pneumococcus, but it's not common. Streptococcus pyogenes is a gas group A Streptococcus, and you can think of Streptococcus pyogenes bacteremia in the setting of skin and soft tissue infections or in the setting of necrotizing fasciitis. And Viridans group Streptococcus can be suspected after dental workup generally. So it's it's commensal of the oral flora. So after dental workup, it's very common. And if you're thinking in terms of a subacute endocarditis, especially in immunocompromised individuals, so you can think of Viridans group Streptococcus. So what about Staphylococcus aureus bacteremia? Remember, it's something when you have a Staphylococcus aureus bacteremia, whether it's MSSA or MRSA, it doesn't matter. It carries a very high mortality. And the most important point is if you see Staph aureus in the blood, it's never ever a contaminant. Very, very important point. Okay. So severity wise, we all know that MRSA is going to produce more severe infections compared to MSSA. And what are the common metastatic complications? Endocarditis, osteomyelitis, septic emboli, brain and lung abscess. All of these things can occur because of the bacteremia caused by Staph aureus. And it requires complete workup because one of the important investigations that you have to do if you see Staph aureus in the blood is echocardiogram to rule out infective endocarditis. And you have to repeat blood cultures and source control is absolutely essential like in any other bacteremic state. So repeat cultures may be required to confirm clearance and empirical treatment will be done with vancomycin or daptomycin till the sensitivity rates are available. Because when it's about bacteremia, always go for bactericidal drugs like vancomycin or daptomycin. Linezolid generally is not preferred in this kind of cases because linezolid is a bacteriostatic drug and it's not really recommended in patients who are having severe, bacteremic states like this. And what about Enterococcus species? So usually the source will be a GI or GU tract. As I told you, it could be due to gut translocation, perforation, or a biliary tract disease. And it's often associated with infective endocarditis also, and early echocardiography is indicated if you see a Enterococcus bacteremia. Pneumococcus infections we are going to see, especially in unvaccinated individuals, elderly patients, alcoholics, and immunosuppressed individuals like HIV patients and post-transplant patients. And you have to screen for HIV in young patients with pneumococcal bacteremia. So if you get a bacteremia or meningitis, especially, one of the important investigations that we do is HIV infections. We have discussed elsewhere about that. And often it's secondary to sinopulmonary disease or meningitis. And there is something called Austrian syndrome. So what do you mean by Austrian syndrome? It's a triad. It contains three things: pneumococcal pneumonia, endocarditis, and meningitis. If all three is there in the patient, so lung is involved, heart is involved, brain is involved. So that is called as Austrian syndrome. So what about Coagulous negative staphylococcus? Most of the time, it can be a contaminant. You have to be careful. That's why multiple positive cultures are recommended. And if the patient is also symptomatic, it's likely to be a true infection, especially from prosthetic material or central venous catheters. If it's a single positive culture, but the patient is asymptomatic, it's likely to be due to a pseudobacteremia, and you can make a note of it as well.